Hi, and welcome back to Your Future, Your Finances. I'm your host, Brian Kuhn. We're talking again with Tracy Russo of HTA Financial Services regarding Medicare and its supplements, a very important topic for our audience. Welcome back.
Thank you.
We were talking before the break about getting signed up for the program. So there's when you sign up for Medicare, there's all these lettered programs, as I understand it. There's A and B and some other ones. So what are those?
Okay, so let me do a nice overview of all of the different parts of Medicare and the supplements. With the federal government Medicare program, there's parts A and B. And part A is your inpatient hospital care for the most part. And for many people, there's no cost to part A. You pay your Medicare taxes over your lifetime. As long as you or a spouse has worked and paid Medicare taxes for 10 years, then part A is a no-cost benefit to the client. Part B, also provided by the federal government, is the outpatient services. So things that normally are included in outpatient are doctors, specialists, labs, x-rays, MRIs, outpatient surgery, outpatient chemotherapy, and even things that you get done in the hospital, like emergency room. And the big one now is hospital observation. So what's going on in hospitals is you're going to the hospital, you're staying 2, maybe 3 days, and when you leave, you find out that you haven't formally been admitted to the hospital. Instead, you were there under observation. So that's considered outpatient and would fall under Medicare Part B. Medicare Part B does have a cost, and the cost is dependent on your income, believe it or not. So for many people, they're going to pay, and this is the 2016 cost that the government set, $121.80 per month. That's assuming that if you file your taxes single, you make less than $85,000, and for a couple, less than $170,000. So that's what the federal government provides. Now, that's a nice baseline coverage, but many people need secondary coverage on top of that, because if you had Medicare alone and something major happened to you, you could have significant out-of-pocket expenses. So that's where people would put either a Medicare supplement or a Medicare Advantage plan on top of Medicare. And let me just talk about the differences of those a little bit. Medicare supplement is a piggyback to Medicare. So you have your Medicare A and B as your primary, and then your supplement as your secondary. And your supplement's going to pick up the deductibles, the co-pays, the co-insurances that Medicare has. So if you go to the doctor, the hospital, and Medicare pays a portion, the supplement normally pays the remainder. So by putting them together, you virtually have close to 100% coverage on all of your Medicare-approved major medical services. And also, in addition to that, there's no doctor networks. The only thing that you want to ask the doctor or the hospital is, do you accept Medicare? As long as they accept Medicare, they absolutely accept your supplement, because it's just a piggyback to Medicare. And then lastly, there's no managed care when you have traditional Medicare and a supplement, meaning you and your doctor get to make all of your medical decisions. You get to do what you think is best for your health care.
Overall, seems like pretty good coverage at a reasonable, as long as you can navigate it correctly, I guess.
Once you get in, I do find that most of my clients, they'll call me a couple months later and say, Tracy, this is the best coverage I've ever had. They really enjoy being in the system because they don't have to worry, do I go and get this looked at? How much is it going to cost me out of pocket? Simple things like you know, skin cancers or basal cell and stuff like that, that could cost several $100s under regular insurance, but with Medicare and a supplement may cost close to nothing.
What are some of the mistakes people make when they enroll?
Well, so when you enroll, there's the two parts. There's the supplement or the Medicare Advantage, and let me just explain what that is real quick, and then that'll tie in with the mistakes. So Medicare Advantage is the managed care piece of Medicare. So rather than having traditional Medicare with a supplement, you can go into a Medicare Advantage plan, and you don't get away from paying that Medicare Part B premium. You're always going to have to pay that regardless of what avenue you take. But Medicare Advantage, it's your primary health care provider moving forward, and it's a managed care program, which means that you and your doctor your doctor and the insurance company work very closely together to determine what your health care needs are. And because of that, your doctor has to decide what insurance companies they want to work with. So what networks do they want to be involved in? In addition to that, Medicare Advantage sometimes includes a prescription drug plan or other nice features to it. But we do find that clients have higher out-of-pocket expenses when they actually get the get the medical services on a Medicare Advantage. So you had asked about what are some of the mistakes that people make. When you go into Medicare, it's very important to think about your decision. Am I going to do a supplement with no managed care and no networks, or am I going to do a Medicare Advantage plan that has managed care and networks, but maybe lower premiums? Because once you're in the system, you have 6 months to get a Medicare supplement without having to answer medical questions.
Okay.
After that, if you ever want to get a Medicare supplement or you want to switch supplements, you would have to answer medical questions to determine if the company wants to take you on as a client. So some people feel because there's an annual Medicare enrollment period each year, they feel, oh, well, I'm just going to make a quick decision because every year I can change it. And that's true for some parts of Medicare, but not for every part of Medicare. In particular, Medicare supplements would not be subject to that being able to change every year without medical questions.
You have in here some of the notes for our talk today, the prescription donut hole, as it's called, if it's all right to go on to that topic.
Sure.
So prescription drugs, there's the donut hole. There's also, if you're not taking anything, do you need a prescription plan? Talk a little bit about that.
So prescription plans like Medicare Part B, although you don't have to enroll in one, there would be a penalty if you don't enroll in one when you become eligible, but decide you want to get into one later. And that penalty is fairly significant. It's 1% per month for every month you could have had it and didn't. So if you wait 4 years, maybe you're not taking any prescriptions, so you wait 4 years to buy your prescription plan, you'll have a 48% penalty on your premium.
That's a lot. That's a big penalty.
And it's for the rest of your life that you'll pay that. So although it's not required that you get a prescription plan, many people do. And if they don't take any prescriptions, they'll get a plan that doesn't cost very much money. The lowest cost plan right now is $18.40 a month. So it's definitely affordable, and it's there in case you need it too. But the donut hole, that's the big topic that everybody's heard about, but nobody really knows what it is. Basically, the way all Medicare prescription plans work, because they're regulated by the government, is you're going to start off and you're going to pay a copay or a small percentage for your prescriptions for a while. But once your costs get to a certain threshold, and in 2017 that threshold is going to be $3,700. So once the retail cost of your prescriptions, not what you're paying, but the full retail cost adds up to $3,700, you fall into a donut hole. And what that means is you're going to pay more for your prescriptions after that. And in 2017, the numbers are you're going to pay 40% for your brand name drugs and 51% of the cost for your generic drugs during that donut hole.
Let's get your information in. We have to wrap up, but definitely some very important information for our viewers and good help. How can people get a hold of you?
Okay, great. So I would encourage you to visit our website. Our website is www.medicarehelpforretirees.com. And on that website, you'll get some general overview of Medicare and information on our services, but it also provides our toll-free number to set up a no-obligation phone consultation.
Fantastic.
And what we'll do during that phone consultation is we will consult with you on when you plan on retiring, when's the proper time to get into Medicare, and we'll send you off with a one-page bullet sheet of all of that information, when, how, and why.
Fantastic.
You need to get into Medicare.
All right. We've been talking with Tracy Russo of HTA Financial. Thanks for watching. This is Your Future, Your Finances.